Through this video, let's see some points on NCLEX RN. Of patients with X-linked agammaglobulinemia or XLA, 5% to 10% developed vaccine-associated polio after vaccination with the live attenuated oral polio vaccine. For that reason, children with XLA and their siblings should be given inactivated polio vaccine rather than oral polio vaccine. The acronym CATCH summarizes the possible clinical manifestation of DiGeorge syndrome, cardiac abnormality, especially tetralogy of Fallot, abnormal phases, thymic aplasia, cleft palate, hypocalcemia, hypoparathyroidism are seen in DiGeorge syndrome. Blood transfusions and hemolytic transfusion reactions. A person with type A blood has A antigen and anti-B antibodies. Person with type B blood has B antigen and anti-A antibodies. A person with AB blood has both A and B antigens and no antibodies. A person with type O has no antigens and both anti-A and anti-B antibodies. To avoid potentially fatal blood reactions, patients should receive only matching blood types. Type AB blood is called a universal recipient because it lacks both anti-A and anti-B antibodies. Type O blood is called the universal donor because it lacks antigens. So, if a patient receives incompatible blood, the patient will complain of chills, fever, pain, and a heat sensation at the transfusion site. A rash may develop. Antibodies cause the foreign erythrocytes causing agglutination or clumping. The clumping blocks the small blood vessels resulting in ischemia. Neutrophils and macrophages phagocytize the clumped cells, causing the release of hemoglobin into the urine and plasma. This reaction causes vascular spasms in the kidney that can cause blockage of the renal tubules. The result can be acute renal failure from the hemoglobinuria. Coagulation is stimulated, which depletes the clotting factors, resulting in massive bleeding. So these are the clinical manifestations shown by the patient. Non-steroidal anti-inflammatory drug warning. NSAIDs may cause an increased risk of serious cardiovascular thrombotic events, myocardial infarction, stroke, renal insufficiency, especially in a stressed kidney. Example, a patient with pre-existing risk factors such as dehydration, or a patient with already compromised renal function, and severe GI adverse events including bleeding, ulceration, and perforation of the stomach. They are contraindicated for the treatment of perioperative pain in the setting of coronary artery bypass graft surgery and patients in renal failure. Hope you understood this video. Thank you so much.